everyone, and welcome to Politico Live. My name is Jillian Deutsch, and I'm one of the health reporters here at Politico. And I'm very excited to be launching this conversation about the future of EU health policy post-COVID-19. The pandemic really put the Commission into a new spotlight and a new role during the pandemic. We really saw the Commission taking charge, helping mitigating drug shortages of ICU medicines. And of course, we saw the Commission really step up and help purchase all of the coronavirus vaccines. Now, the pandemic also really thrust the Commission into a sometimes not so nice spotlight. We saw the Commission really come under fire for months over the slow rollout of vaccination campaigns across the bloc. And we even saw the Commission get into quite the spat with AstraZeneca, one of the vaccine producers. Now, though, the mood has changed in Europe. We see a lot more people who are vaccinated, including hopefully many of you in our virtual audience. Congrats to those who have gotten a vaccine. And the Commission now is really ready to dust itself off and start a new chapter of EU health policy. We see the Commission wanting to get more vaccines. They want to purchase therapeutics. And now they also are getting ready to start a new agency to better prepare the EU for future pandemics. But that's enough rambling from me. We have four really interesting speakers I have many questions for, including, what will these plans that the Commission has really work? Are they too much? Are they not enough? I'm going to go through our speakers and introduce them. So speakers, while I introduce you, please wave to our virtual audience. First off, we have Elvire Aronica, who is the Deputy Delegate for European and International Affairs at the French Health Ministry. Hello, Elvire. We have Pierre Delceau, the Deputy Director General of DG Santé at the European Commission. Very excited to have you, Pierre. We have Aniek de Ruyter, who is an Associate Professor of European Law at the University of Amsterdam. It's very nice to see you again, Aniek. And last but not least, we have Nathalie Mol, who is the Director General of FPA, which stands for the European Federation of Pharmaceutical Industries and Associates. Hi, Nathalie.
Good morning.
I wanted to also let you know in this virtual audience, you also can participate. What you can do is you can go to Slido, which is sli.do. There you can send us your questions using the hashtag EvolveHealthcare. And I should also say, even if you're too shy to ask a question, although I really hope you step up and ask these important questions to our awesome speakers. But we do have a poll as well. Our question for you is, will HERA, this new agency that the Commission is proposing, be enough to prepare the EU for the next pandemic? Easy, yes or no? Now, to kick things off, I want to start off with a hopefully simple question. In one word, to our speakers, in one word, how do you feel about the EU taking more action in health policy? Pierre, what do you think?
Positive.
Positive, nice. Nathalie?
Important.
Important. Aniek?
Positive.
Positive. And Elvire?
Positive, of course.
That's a nice dose of positive energy to kick things off with. Pierre, I really want to start talking, of course, about the vaccine saga that we really saw play out in the early stages of this year. We saw lots of citizens who were quite angry with the Commission over the purchasing of the vaccines, sometimes even EU leaders as well, criticizing the Commission. I'm curious, from within DG Santé, what was that like to face all that criticism?
First of all, good morning to everybody, and thank you very much, Gillian, for your question. It's always easy to criticize. It's much more difficult to do things. And let's be very clear, if the Commission with the member state had not decided to work together to purchase vaccines for all of the European population, things would have been much worse now. And if you look now, after more than 1 year, a little bit more than 1 year of the beginning of the crisis, as you say, most of the European population, almost half of the European population, has a chance to have received today a first shot of the vaccines. And very likely, as we promised, for July, for the end of July, 70% of the population will get vaccinated, will be vaccinated. So to come back to your question, we have to be honest. If we had not worked together, the Commission and the member state, and Sinance working to purchase those vaccines and to help also the development of those vaccines, I do not believe that we would be in such a position now, especially not in all member states. Because let's not forget that dimension. What we have done it not only for a few member states, we have done it for the 27 member states. And I believe that was an important message. And something we just, really seeing it, from the inside and seeing also as a citizen, it was amazing, the solidarity between the member states in this respect. Of course, there were tensions, there were difficult discussions, sometimes, negotiations between the member states. But at the end of the day, there was always a consensus which was found. And I believe that demonstrated also the links which exist between us Europeans. And again, I know criticism was there because at the beginning, of course, it was a slow pace. But let's also be very clear. It was a slow pace because of one company. And you know the situation with this company. You know that yesterday we had a trial with this company. I don't want to focus on that, but that was one of the major difficulties at the beginning. Because otherwise, we have been able to obtain the vaccines that we wanted to get. We've been able to send them to the member state, and member states have been able to start vaccination. And the mood has changed now because people are talking about the summer vacation, the possibility of going in vacation. But again, let's not forget, all of this took place in less than 1 year. And that's quite impressive because when you know how much time is normally needed to develop a vaccine, how much time it's needed to negotiate contracts, to distribute the vaccines and so on, it's quite impressive. So, in Europe, we sometimes have a tendency to always be negative about what we do. Everything is always better elsewhere. Everything is better in the US, in China, in Israel, everywhere. Actually, we should be proud of what we have achieved, all of us together, because that's also for me the main message. It was done not only by the Commission, of course, the leadership was with the Commission, but also with all the member states. And again, quite impressive result. I would stop here.
Absolutely. I mean, so I definitely understand that perspective. The grass is always greener, the US, the UK, Israel. I'm going to ask you more, of course, about this lawsuit with AstraZeneca. But first, I want to actually ask Anique, you've really studied the history of pandemics and what happens when the EU does not coordinate. Could you give us a brief history of what happened during the swine flu pandemic when we definitely did not have this kind of coordinated action in Brussels?
Yeah, so it's important to remember that because I think that would have been a blueprint for what would have happened if the EU would not have been able to come together on this joint procurement of vaccines, and then probably times 10. Because during swine flu, of course, there wasn't a strong role for the EU yet to coordinate the joint procurement of vaccines. Actually, there wasn't a super strong role for the EU even after swine flu, but still some arrangement had been made. But during swine flu, of course, the pharmaceutical companies were able to play member states out against each other. At the time, the UK really had way more than it needed, and then it had to, and some other member states as well, then it had to offload some of these vaccines to other member states that then by then it had already, people were already convinced that the swine flu wasn't as dangerous, so there was really many people didn't even want to be vaccinated at all. So there was, basically it was a chaos, and it was not very solidary within the EU, and the classical divides that are there with East and West and all of that were very, very sharply drawn at the time. And I think that is very important that we see a huge difference in that respect.
Absolutely, Anique. I mean, we definitely saw kind of every member state for themselves. One of the main arguments that I think the Commission and many people in the EU make is that, for the smaller member states, it's actually very helpful to have the Commission really in the driving seat of these negotiations. But for larger member states, of course, like Elvire, you're from France, I'm curious what it's like for a bigger member state that very feasibly could have procured plenty of vaccines on its own or possibly through this 4-country vaccine alliance. What is the argument you make for citizens, to citizens, about why France should team up to help Malta, Estonia get vaccines as well?
Well, thank you, Julian, for giving me the floor. I want, first of all, to thank POLITICO for having invited me as a member state administrative representative to participate to this very interesting virtual discussion. But you might know that as a representative of a member state and above all of an oncoming presidency of the Council of the EU, you will understand that I am bound by a duty of reserve regarding the negotiation underway with our European partners, of course. However, it is of course, also an opportunity to share our experiences with all the participants to this panel. We can say that health sector already took last year a growing part in the expectation of all the European citizens, and of course in France particularly. And in 2020, we saw a growing interest of a European citizen. The last barometer shows that it is very important for our citizens. So for our citizens, we have the interest to work all together because with all 27 countries, we are stronger. Even if alone we could have bought all the vaccines, we know that we couldn't have the same opportunities to negotiate as European Union and the Commission did, and go on to share with us. So it's not a question for us. It's a question of solidarity. And it's a way to prevent all the complication and the impact of the crisis that we are. It's better for us to be all together.
Absolutely. That's a very positive message, especially moving forward. Natalie, I'm curious, I mean, from a pharma perspective, does pharma prefer actually, rather than going member state to member state, even though you maybe can secure better prices from some of the more wealthy countries, is it actually just better? Are you guys glad that the Commission really stepped up and purchased vaccines for the bloc? And do you want to see the Commission take a step and continue to purchase medicines for the whole bloc?
Well, thanks, Gillian, for the question, and thank you for the invitation. I think the COVID-19 pandemic is a very different set of circumstances than any other health threat or health condition that we see. And, the way that medicines are at the moment distributed in Europe depends on the needs of a country, on the socioeconomic makeup, on the health pressure, on the healthcare system, on a number of things, whereas COVID-19 is a crisis where we are looking to vaccinate as many people as possible, as quickly as possible to get that coverage. So I think it's a different set of circumstances, and therefore we've treated it in a very different way, both from the research side, in terms of the speed that Pierre was alluding to before, the incredible coming together. That is something that I would love to see for many diseases, the incredible coming together of all the players in healthcare to really make the best of what we have and come up with solutions very quickly. But in terms of, I think, procuring, it's just a very different product, and joint procurement makes sense when it improves access to a product. And it needs to be limited to situations when the purchase cannot be done by other means, that access cannot be allowed. So I think there are amazing things that came out from this pandemic, that silver lining of such a terrible crisis, which is learning to work together, learning to trust each other, building on one another's strengths. Whether it was at the very beginning, which I remember acutely, when borders were closing and we couldn't get medicines to people, and we had to really work hand in hand on a weekly basis to make sure that patients still received their medicines and make sure that the protective personal equipment was there. And then in the second phase of the pandemic, when that at some point overlapped, when we were developing and creating those vaccines and now distributing them, I really think an incredible lesson in European solidarity, as Pierre was saying, and hopefully something that we can carry with us in the future on how to manage health in a concerted way.
So Natalie, is it fair to say that you feel like, okay, yes, during the pandemic, this was very helpful. You're not wasting your time talking to 27 member states. But, in 2023, we should keep going by member states rather than having the Commission come out and really purchase most medicines for the bloc.
I think, every country has a different need and a different socioeconomic setup, a different pressure also of diseases. Some diseases are more prevalent in some countries and some less in others. And what we try to do as an industry is adapt to the needs of those countries. You also have completely different healthcare pathways, preparedness of healthcare systems, and in some cases there's a need for more support before that therapy can actually be, if you think about, for example, CAR-T, so advanced therapies, not every country at the moment is set up to be able to enable the adoption of those medicines, so it wouldn't make much sense to purchase them in block and then redistribute them out. There really is a tailored a need for a tailored conversation and for adaptations and partnering in order to make sure that the medicines meet the patients or reach the patients and get the right outcomes in each country. So it's more of a case by case, importantly for therapies, than it is in vaccination when you're trying to vaccinate everybody, which is different, of course.
Absolutely. Pierre, I want to throw it back to you because, of course, whether or not the Commission actually purchases more medicines or more vaccines really comes down to whether you have the sign-off, the buy-in from member states. Do you think these early months of 2021, where there was so much criticism on the Commission, do you think that will have a long-term negative effect on the Commission's ability to purchase more medicines in the future?
So I would like to come back to the particular situation of the COVID, and come back also to a certain extent to your question. Maybe it's true that some of the wealthiest member states would have been able to purchase, the vaccination alone. But let's not forget we live in a European Union without any borders, meaning that if not everybody is getting vaccinated, what's the solution? You have to close the borders, and we destroy what has been our economic strength, which is opening up the borders and making sure that we work, as an open market between the different member states. So in the case of pandemics, which affects all member states, it was a requirement to make sure that everybody gets a chance to be vaccinated, because that was a key to maintain the opening of the borders. Without this, even if France or Germany would have been able to purchase maybe vaccines and obtain that the population is vaccinating, it would have meant that they would be forced to close the border to the rest of Europe, because otherwise, you never know, what will be the situation. So the point is, solidarity was the only way forward, the only way possible to find a solution to this pandemic, because it affects all. And actually, if I want to expand on this, actually solidarity should not be limited to our borders. We should also, European Union borders, we should look also outside of the European borders, because it's also important that at the end of the day, everybody in the world has a chance to be vaccinated. So I believe this is something it's important in the context of a pandemic. Now, coming back to your question about the situation, yes, it was difficult, but let's not forget also one thing. Everything which is done in respect to the purchase of vaccine has been led by the Commission, of course, clearly. And I want to thank, Sandra Gelina for the work and her team for the work that she has done. I say it even if I work for the Commission and I work with her, but she needs to be thanked for what she has done in this context. But the point is, it was not done in isolation by the Commission. Member states were closely associated to all decisions. They were informed of the negotiation. They were part of every decision which was taken. So it's not like the Commission, doing things in isolation and then coming to the member state and it's take it or leave it. No, actually, they were fully on board. And of course, it was sometimes, as I said, it was sometimes difficult, challenging, complicated. But at the end of the day, there was always solution. So to come back really to the core of your question, yes, there were criticism because, of course, there were anxiety not from several member states, for all member states actually, on the fact that not enough vaccines were delivered. But again, if you look at it from far away, I know it's difficult. But it's amazing that, already in December, the vaccination started. It's amazing that already in January, there were, thousands of people being vaccinated in all member states. And now we are talking about almost 50% of the population having received one shot of a vaccine in Europe, and we are only in May. So, this is quite impressive, the way we've been to do it. And let's not forget, the people are talking about, for instance, Israel and so on, but Israel is a small country and they've accepted conditions which would have never been acceptable for Europeans. So we have done well and we should be proud of it. I want to insist on this because sometimes, as I say, in Europe, we love saying we are not good enough. We have been extremely good in this context and we should be proud of this. Now, to your question for the future purchase, let's be honest, we've done it in the context of a pandemic. And pandemic, of course, and as you know, we have already now concluded a new contract for 2022 and 2023 with one vaccine producers, and probably, as a negotiation will take place with others. But that's linked to the pandemic. And of course, we also done joint procurement, but for equipment which was needed for all Europeans, all member states. Now, does it mean that the Commission will become the purchasing power of all member states for all kinds of medicines in Europe? I don't think so. And that's not certainly not the objective. And of course, but one thing which is certainly important for us with respect to medicine, even if we do not become, the purchasing power of member states with respect to medicine, it's important that all European citizens should have the same access to the same medicines. We don't want second-class citizens. We only want first-class citizens with respect to access to medicines.
Absolutely, Pierre. I'm curious, though, so much of the future portfolio for vaccines up to 2023. Well, right now the Commission has signed a deal with Pfizer for billions of vaccines. I'm curious. I've heard a lot of concerns from member states, from diplomats, basically saying there's kind of a heavy dependence on Pfizer. There might be a deal in the works with Moderna. Maybe we'll get some more J&J. Maybe there's this Novavax deal that will actually materialize someday. But AstraZeneca is not going to be part of the future portfolio. Is there a legitimacy to this concern that actually that the whole EU is going to basically just become a Pfizer continent? What if Pfizer has an issue 2 months down the road?
First of all, I would like to say we are talking about Pfizer and BioNTech. Let's not forget also the European dimension, the clear European dimension, and BioNTech plays a very important role in the development of the vaccine. So let's never forget this. But have you read that we have signed an exclusive contract with Pfizer and BioNTech? No. I've not seen it. And actually, the president of the Commission was extremely clear when she announced the signature of this contract. She said, of course, we will look at also other opportunities, and we don't want to be in a dependence with one producer, because for many reasons, you never know what could happen. It's not a question where we don't believe they will not be able to deliver, but you never know, if there is an incident, something which is important. So we are fully aware of this. And again, I need to come back to this because that's really important. It's not the Commission alone deciding, it's with the member states on board. And so they are fully aware. And it's important that we have secured this agreement, but it's probably not the last agreement that we'll conclude with the vaccine producers. And also to come back to one of the implicit questions, I know there is also this fear of a dependence with Pfizer and BioNTech. Again, I keep insisting on BioNTech. But there is also this fear, we have purchased too much. But the question is, we don't know how much will be needed. Nobody knows whether, first of all, nobody knows whether we really need a booster. Will it be one or two? How many times do we need to repeat the operation? Nobody has a clue for the moment. We have some indication, but nobody knows. And let's also be clear, there is also the fear that, there is a new variant which might appear. And again, I don't want to be too pessimistic. I hope it will never appear. But we need also to be ready for that situation where a new variant, which will be, more dangerous, would appear. And we need to be ready for this. So again, no exclusivity, but it's important that we have already secured the future of our European citizens. What we want is to make sure that all citizens in Europe, and probably elsewhere in the world also medium term, but all citizens in Europe will be able to get the appropriate vaccination in 2022 and 2023. What will it be? I don't know, but certainly it's important that we are already now sure of this.
Absolutely. I want to get to one of the first points actually that you made when we first began this conversation. You said that, when the main reason for the slow pace of the vaccination campaigns was down to one company. Of course, you're talking about AstraZeneca. Yesterday, I was just in the courtroom at Palais de Justice, watching the first hearing of this big court case between the Commission and AstraZeneca. I'm really curious, for pharma companies watching AstraZeneca be taken to court, what is the message that they should receive from this?
Is it a question for me again?
Yes.
No, I believe the questions that the point that we want to make, that we are serious. When we talk about, the health of our citizens, we need to be serious. And when you take a commitment for such an important question like vaccination, and you take a commitment to deliver certain quantities, it's not just an abstract commitment. It means that member state people are waiting to receive these vaccines, are waiting to be protected from a very dangerous disease. So the message that we want to send simply, and it's very clear, it's just to say, if you take a commitment, if you sign an agreement, you need to deliver. That's all. And I believe, it's too easy to take commitments, to receive EU money, to agree to certain things, and then not to deliver. let's be very clear and let's be very transparent because it's public knowledge. As you know, some member states have relied more heavily on AstraZeneca vaccines than others. And of course, for those member states which have taken such a decision, the fact of not receiving the quantities which were promised by AstraZeneca is a disaster. And it has affected. We can say, unfortunately, that probably some people have died because of the fact that there was not enough vaccine. Again, I know it's a complex issue. We'll see what the tribunal will say. Of course, I don't want to anticipate the decision. But the message simply we wanted to convey to a producer is simply, we are serious. If you take a commitment, you need to deliver on this commitment.
Natalie, I'm curious you represent pharma companies. What is the message that lawsuit sends to pharma companies around the EU?
I think the important thing about, Gillian, about this pandemic and about the development of vaccines, as we discussed since the beginning, is the complexity of finding those vaccines and then upscaling the manufacturing to reach billions. And we've never done that before. None of us in humanity has ever done that before. Neither finding vaccines. There are still 20, I think, in phase 3 and about 100 still in different clinical trial phases. So, we put everything we had to develop vaccines suddenly on top of everything else that pharmaceutical companies do. So it's not that we suddenly swapped and stopped doing all the other therapies. But then we had this incredible, so that was the first challenge. The second challenge was, okay, now we have to produce billions of doses. And how do we do that with these living organisms that we usually produce in thousands of doses or millions of doses, perhaps at best. And I think that what you have seen is a dedication and an ingenuity that none of us have ever had to show to that extent before. All of us around the world, but especially in the pharma industry, working 24/7 to find those vaccines and then develop them, and now to manufacture them at that incredible scale. And there are bottlenecks. There are bottlenecks not only in the scientific procedures to do that, putting them in 2,000-liter vats, things that normally you put in maybe 1, 2, 3, 4, 10-liter vats, but also being able to find the raw materials at the speed that is needed to upscale to the needs that the population has. There are only, and I'm going to stop soon, but there are only a few vaccines approved today. There are hopefully others coming on tap soon. But at the moment, the pressure on those few vaccines that I've approved to reach the billions that everybody wants by the end of the year is incredible and unprecedented. And I think we shouldn't underestimate the challenges that our companies have had to face and are still facing today, but also the dedication that we're putting into being able to protect the whole world. I really hope that also comes through. As a scientist, I'm acutely aware of the difficulties of producing the vaccines, and I really hope that we can continue to support everything that is needed in order to get the raw materials to the right places, to help the scale up, and to make sure that we share doses that are in excess in any countries today to reach those who need them the most.
Absolutely. I'm curious, do you think that this lawsuit will have a negative impact on pharma companies' long-term investments in the EU?
It certainly sends a message of lack of, let's say, it's not maybe the best way to look into a partnership, of course. I'm not privy to the details. It's a company-specific issue, of course. On the side of industry, there is no doubt that there has been everything has been tried in order to be able to meet the requirements and the expectations, because it is in our interest as well to vaccinate as many people as possible and to get those vaccines out. So I think there's been no lack of goodwill on the part of the industry. And the important thing now is really to make sure that is a law case, and that's, it's happening. But at the same time, we shouldn't let it dampen any of the efforts that we've been doing, and also not put into question the framework that we're setting up for the future and the management of any future pandemics that might be any of the pandemic before even vaccines came along.
Absolutely. And Natalie, one more question for you, and I promise we'll get to the future as well, not just rehashing some of these issues with the vaccines. But I am curious, what you're saying is basically pharma has played ball. We've tried really hard to ramp up manufacturing as much as possible in an emergency situation. I know that for you, actually, one of the biggest issues has been the export controls that the Commission implemented, which is interesting because the Commission has always kind of said, compared to the US and the UK, we've actually exported tons of vaccines. I'm curious what you make of this argument from the Commission.
This pandemic has shown us that we have to learn by doing, and from everything, from working from home to teaching children from home to inventing new vaccines to scaling them up to billions of doses to distributing them to getting people vaccinated. And I think that also in this sense, the reaction at the beginning of the year by the Commission to impose an export mechanism for us as an industry was certainly the wrong thing to do. And we said it very clearly. We didn't believe that was a measure that facilitated the scale up of manufacturing that was necessary. It created a lot more bureaucracy, and it's something that we don't need right now. But it's very encouraging to hear the messages lately from President von der Leyen addressing any export restrictions with the understanding that we need to facilitate trade and ensure that all the hundreds of components that make up vaccines are available. And secondly, that we share excess doses as quickly as possible to countries who need them. So, I think it's a learning by doing, hopefully. I'm always an optimist in that. And Europe has been incredibly solidarity with the rest of the world. And I'm so proud to be a European, I have to say. In this pandemic, I'm extremely proud of the way Europe has dealt with not only its citizens, but the citizens of the world.
Absolutely. Elvira, I'm curious, one of the things that the Commission has done throughout the pandemic is to propose tons of legislation to really increase the amount of power, or at least the power of various agencies that the EU has, including the ECDC, the European Medicines Agency. I'm curious, though, from a member state perspective, how do you feel about this flurry of legislation? You have so many EU Health Union files moving through. Is it too much for member states?
Well, first of all, you have to know, and we know that we have a strong willingness to come out this crisis stronger and with the new capacities to better anticipate, prepare, and also protect our populations. We have results requirements. So what we are doing now and building with the European Commission is a part of the recovery and of the strong willingness. Even we are facing a lot of text. It is due to the necessity to go faster, but also we have to take time to better prepare our future. We have the dilemma to do quickly to make improvements rapidly, and also we have to think about how to organize to better prepare ourselves. So it's the way we are working together is very positive in these two parts.
Great. Do you think, though, that some of these files are moving too quickly and there's not enough time to really assess their impact?
Well, when we were facing the crisis, nobody had time. We were obliged to react very quickly. And so we are on this trend now. We have to go further and also to measure the impact of what we are building now. And I know that it is doing well, and we are on the way to balance between all, to have a better way to work on these two aspects.
Absolutely. And I'm really curious what you think of all of these all the legislation moving through to kind of bolster the EU's response. I mean, do you think that we're moving too slowly? Are we moving too fast? Are we not doing enough?
Well, from a political standpoint, I can understand it because you have to strike the iron when it's hot. And this is right now, the window of opportunity closes quickly. We've seen that after swine flu as well. So I think that it's very understandable that the European Union is now trying to create a better preparedness because it could have been better prepared if better lessons or some of these arrangements would have been made before we came into the situation where we are now. I do think that one of the important things that could be done is to, because we're talking about a European health union, but what does that really mean? Is to improve the voice of the health community at EU level. And I think for that, it would be important to perhaps in the context of the Conference for Europe, talk about what could be done in the treaties to improve the power of the EU to sometimes even maybe not legislate in health. So there is a little bit of a paradox there. But I think that what we've seen in the past is that health laws and policies in the EU have been made by internal market actors or by agriculture actors, but not by health actors because they haven't been empowered in the treaties. And I think that for the member states to have a stronger say in the field of health at EU level, so the health ministries and the connected health communities at member state level, it would be very important to improve the power of the of those representations through a legal basis, through an improved legal basis in the treaty.
Absolutely. You mentioned that the window of opportunity closes very quickly. I'm curious, I remember all of last year we heard from quite some prominent EU leaders, including Macron and Merkel, saying we should give some of these EU agencies more power and the EU should be more in the driving seat sometimes of health policy. Do you think this is all just going to amount to talk?
No, I don't think so. I think there are some regulations that have already been proposed where these powers are improved. I do think it's a dangerous road to be creating agencies and to be creating stronger agencies and more powerful agencies and not improving the democratic legitimacy in the field of health. Because these agencies need to be controlled. It's all executive power, and executive power needs to be controlled by democratic actors. And that means improving improving the legal base in the field of health so that democratic actors, parliamentary representations can have a say over what these agencies are doing.
Absolutely. And audience, I'm going to throw it to audience questions in about 5 minutes, so definitely feel free to send your questions. I see we have a decent number already, but now is your chance to be heard. But I want to ask first all of the panelists the question that we've opened for the public. Do you think HERA will be the hero and save the EU's shortcomings come the next pandemic? Pierre, I'll start with you.
First of all, I hope we will never have a new pandemic. So that would be, of course, the best scenario. But more realistically, HERA is an important element, and HERA is something that we need to put into place. Because let's be very clear, and it was not, clear at the beginning of this crisis, we were not ready. We were not ready. And of course, nobody was really ready in the world, that's clear. But we could have been better prepared for the crisis. And so it's clear that HERA will be a very important element, will be something which will be needed also to try to mobilize the resources which exist within the EU at the level of the member state, at the EU level, to make sure actually that we are better prepared for the future. So that's one important element. But I need to be honest, of course, we need other elements. As we know, in the health sector, it's not only, we need the cooperation of the member states. We need to make sure that member states will continue to develop and also develop their own system and work in coordination, all of us together. We need the industry to be ready. And, the issue of industry and the issue also of resilience of the industry, of the European industry, is something which is extremely important and will be part of the pharmaceutical legislation that on which we are working. It's an important element of the revision of the pharmaceutical legislation. But this is also a very important element to make sure that we need to have, different elements if we want to be ready for the future. We need to have, as I say, HERA is there. We need to have appropriate regulation. We need the appropriate agency working democratically, as Annick has said, but we need the appropriate appropriate agency to be fully equipped and to be ready for the future, and with the industry, because without industry, of course, we will not be able to achieve what we want to do. So it's a combination of things. But, trying to avoid to create error by saying it's not sufficient, then basically you don't do anything. And if I want to make to come back to one of the points you made, we have had the financial crisis. And actually, I was involved, I'm not sure. Anyway, I was involved in the financial crisis and the discussion following the financial crisis. But after the financial crisis, we were able to put, member states and the European Commission were able to put into place mechanisms to try to avoid a new financial crisis. And that the banking union, that's what we have created, integration of bank system, supervision, regulation, and so on. And, during this crisis, we had, of course, the COVID crisis, but we had the economic crisis. But something which was interesting, between brackets, probably not the right word, but still, which was interesting, that the banking sector was resilient during this crisis. And that's probably because of the measures that we took after the financial crisis, that we have been able to make sure that now, in the current crisis, despite the economic situation, the banking sector has been resilient in most member states. So that's something we need also, a lesson we need to learn for the future. If we make the parallel with, health sector, we need to continue to work to reinforce the health sector at European level, but also at national level. Because, of course, member states will keep their competencies in the health sector. And so we need to make sure that health remains important, remains on the agenda of everybody in Europe and actually elsewhere in the world. Because if there is also one key lesson from this crisis, it's the fact actually that health is fundamental. If we are not able to address the health issue, we see the results of the economy. Of course, we see the results in terms of dead people, of people being sick and so on, which is terrible. But also we see the result in terms of economy and the way we live. So, it's fundamental that we continue to address the issue of health and we find appropriate solutions. And ERA is one piece of the jigsaw, it's one element, but it's a very important element, and we need to put it into place as soon as possible.
Natalie, Pierre just said, without industry, the EU really can't do anything. I'm curious, do you think that the proposal or the idea for HERO will be enough?
Thanks, Gillian, and I couldn't agree more with what Pierre just said. I think what was really interesting for me is to hear, we ensured the resilience of the banking system by making sure that the right framework was in place for the industry, so for the banking industry. I really believe that that's extremely important. And, I'm glad that we had such a strong research ecosystem, innovation ecosystem in Europe that could allow us as a region to participate in addressing this crisis. So I'm not going to say solve, because I think there are many elements that came in to solve it, but certainly in terms of finding the vaccines and now scaling them up, that's what industry is able to contribute very realistically to this crisis. I really believe that it's important to look carefully at the pharmaceutical strategy and the industrial strategies that have just been published by the Commission in the last 6-7 months, because I am not sure that looking at those elements to ensure the resilience of the pharmaceutical industry, the innovative pharmaceutical industry, are there. And that concerns me. When I look at those documents, I see a lot about manufacturing. I see the possibility to future-proof our regulatory system, which is great. That is a definite plus, and the opportunity to really become front runners in the products and adapt.
Natalie, I think we're losing our connection.
This is where we are getting rid of them, linking them to access of products. Sorry, are you losing? Can you hear me?
I can hear you now. Yes, we try to just wrap up a little bit. Sorry, I think the connection's a bit patchy.
Sorry, it depends on the days. I don't know where I got to, but what I was saying is in those two strategic frameworks that are very important, what we see is, a focus on manufacturing and an opportunity to improve our regulatory system, to get products approved faster and to adapt to new technologies. But what we also see is a destabilizing of incentives, a destabilizing of that environment that attracts investors to Europe and that ensures innovation continues to flourish. And that's very concerning, because the drive for pharmaceutical innovation, it's a global drive at the moment. Different regions are upping their environments, their incentive environments, etc. etc., to attract innovation and to attract innovators. And if Europe starts wavering in that sense and giving messages that for us we are decreasing our incentives or connecting them to things that are not really the purpose of incentives, which is to motivate research and support research, then we're sending the wrong signal. And I don't know if, what I read today doesn't show me that we're trying to ensure the resilience of the innovative pharma industry. We have a few years to work on the pharma strategy and the industrial strategy. I really hope that in the implementation, we can work together to make sure that the outcome of those strategies is really an environment where this industry that has been so key in helping find solutions to this world pandemic can continue to thrive in Europe as well and find solutions for the future, not just for pandemics, but for all health threats. And so I look forward to working together with the institutions in order to change that a little bit.
So I think we're having some technical difficulties. If you can hear me.
I can hear you, Julian, but you probably
You guys
lost
still
it.
hear me though. Okay, I can't hear you guys, but I will continue anyway and just see where we go. I am curious though, Elvire, I know, you're hearing lots of proposals about what the EU can do to improve for the future pandemic, or for a future pandemic. From a member state perspective, how would HERA actually help you?
Well, you know that this crisis, this health crisis, has shown us that we must better support our health system. So we have to not only to reinforce the hospital and our intensive care units, but also, for instance, primary health care, medical specialties, mental health. If we want our systems to be resilient as a whole, we need to reinforce our health system, not at national level, but also at the European level. We must work on the healthcare supply at all the level of the territories. We must think about the continuity of healthcare, and so that means that we must invest more in the daily healthcare services to make them more resilient, to modernize and transform our health systems, and to address their sustainability. That is why, for instance, in France, we have launched a consultation about that on health systems, with the health system stakeholders, and the conclusion has led to the adoption of a plan to boost investments with a total amount of 6 billion euros. And these investments are also financed in part by the European Recovery and Resilience Facility. It enables us to better manage future pandemics and also to assure better performance of all our working tools. So that is now the next steps for us.
Absolutely. I couldn't hear most of that because we had some technical difficulties, but I am back. So I can now hear you guys, which is excellent. I have one more question for one of the panelists, and then I see tons of interesting questions coming in from our very educated audience. Monique, for you, what do you think is instrumental to making sure HERA functions well?
It's doing it, right? It's doing it on the ground. I mean, you can create the laws and the policies, but in the end, it's all going to come down to member states, all the partners within such an effort to contribute their knowledge and their expertise. I think this whole conversation is very interesting because you see all the tensions that are there between the member states. The responsibilities member states have on the ground to create resilience, and at the same time having to work with the European Union because there's so much added benefit in doing things together. But what is the precise balance to which you do stuff together and to which you go at it alone? And in the same way, the tensions with the industries that are involved. You were talking about should there be more efforts for joint procurement, or do we really need industry for innovations? Of course, we know that this whole pandemic has shown that there is an important role to play for public authority, for government, both in terms of innovation, because there was huge public investment in innovation on these vaccines, but also in for instance, procurement, maybe not of all medicines, but for some medicines, like maybe antibiotics, there are definitely pandemic vaccines, but there are some other medicines, orphan medicines for rare diseases. There are definitely some dossiers that where more public involvement would be very interesting, and certainly innovation doesn't only come from the industry either. So there's lots of tensions, lots of difficult balances that need to be drawn for the future of EU health, I think.
Absolutely. Thank you, Aniek. I'm going to throw this now to our audience, who are sending a bunch of very interesting questions. Two of the questions I see are for you, Pierre, I think. Are you definitely best poised to answer them? These questions from Sarah. There are two questions about this EU FAB project. First, who's overseeing it? And second, what is the scope for it? Is there, for this flexible EU FAB manufacturing center under HERA, will it cover active pharmaceutical ingredients?
First of all, as you say, EU FAB is still a project at this stage, so we are still reflecting on the exact content and what really is the exact scope of EU FAB. As you know, the concept is something which we believe is important. That's simply what we noticed, of course, and that was clear during the crisis. It was clear that it was important to have some kind of reserve industrial capacity, which could be activated in the case of a crisis when we need it, to develop new capabilities. So the idea is really to create this kind of active, network of capacity, industrial capacity in Europe, which could be, used when needed. Now, what will be the exact scope? What will be done? We don't know at this stage. But you are talking about active substance. But for instance, one idea also we are exploring is the question of therapeutics, because so far we have focused a lot on the vaccination, which of course is extremely important, and I do not deny it. But you might have seen also that we have adopted a strategy on therapeutics, because we also need to look at that path. We need to make sure that we develop also therapeutics in Europe. And I know quite a lot of companies are working on this. And to come back to Natalie's point, yes, research and innovation is important also in this field, because it would be extremely important to find the appropriate therapeutics. So the idea is also to look, if we were to develop this kind of new therapeutics, do we need maybe to have this kind of reserve capacity which could be activated? Again, at this stage, what we are doing now is putting on the table this idea of a EU FAB, talking to the member state, talking to industry, talking to all stakeholders to see how we can put it into place and what it will mean. But again, if we look at I started by saying, we should not believe that the grass is greener outside of the EU, but still, we can look at experiences taking place elsewhere in the world. And in the US, as you know, they have BARDA, and BARDA has this possibility to activate this kind of capacity, and it was useful. So we are trying to see what we can do in Europe. Of course, it's a little bit more complicated in Europe because we are not one country. We have 27 member states. We need to take into account the fact that, local dimension and so on, which is important. But again, I don't have all the solution now, but I know one thing. Even if I don't have all the solution, we need to move forward. We need to develop new ideas. We need to put them into practice, and we need to agree on those ideas. And to come back to Aniek's point, yes, maybe there are tensions, but I believe those are useful tensions because it will lead us to better results and to things which, would be at the end of the day good for our citizens. Because let's not forget one thing. At the end of the day, what we do it for the citizens. We don't do it for bureaucrats like me. We don't do it for the industry. We do it at the end of the day for all our citizens in Europe. And again, I want to insist on something I said before, but I believe it's important. I only want to have first-class citizens in Europe. I don't want to have second-class or third-class citizens, only first-class citizens. And it's only by working together that we can achieve this.
Absolutely, Pierre. I'm also seeing some questions from the audience, also asking more about longer-term resilience in the EU. For example, you're talking about therapeutics to really combat COVID, but we also know that healthcare systems are grappling with patients who have long COVID. Experts are warning about mental health crisis looming. And then we also have tons of groups here who are based in Brussels who really focus on prevention. Do you think that the EU really will build its resilience in terms of prevention and these more longer-term health issues coming up?
I believe, again, it's the EU and the member state, because as Elvira has said, of course, some measures needs to be taken at the level of the member state. We are not going to build new hospitals and so on. But it's clear also that we have now new financial possibilities, for instance, which are extremely important. We have not yet mentioned it, but as you know, we have this Recovery and Resilience Fund, which is now being activated, which is now in force, and where member states are submitting projects and to develop, the economy following the crisis. And one important sector on which we really want member states to invest and to develop things is the health sector. We need to be consistent, of course. As say, health is important. So for us, it's one of the priority on which member states should invest. So this is already a very powerful element. Second element, which is also extremely important and which is new, let's be clear, that's EU for health. Nobody has mentioned EU for health now, but for the first time, we have a relatively large budget which is available to finance projects in the field of health. And of course, in this context, prevention is one of the important topics which, has been already identified by the co-legislator, like also the issue of non-communicable diseases, which is extremely important in Europe, and there is a long list of non-communicable diseases. So EU for health is also a powerful tool. Last but not least also, Horizon Europe, Horizon Europe is and coming back to what Natalie said, Horizon Europe is a powerful element, powerful vector to invest in research and to make sure actually that we continue to be in the lead. Because let's be very clear also, we are not alone in the world. We know that other parts of the world are investing massively in research in the field of health. We need to be able to compete with them. And we have the leverage, the use of Horizon Europe in this context is extremely important. And again, I'm not saying we should do it alone as a EU. The idea is really to make it together, with member states and with industry.
Absolutely. I think your point about member states' willingness is actually something that's coming up a lot from the audience. So, Elvira, I'm curious from a member state perspective, we have a couple of questions talking about, member states have demonstrated they're not ready to follow EU recommendations in public health. Someone who did not choose to unveil their name, but was specifically referring to the reluctance to follow ECDC guidance. I'm curious, if that kind of reluctance is going to impact HERA's ability to do anything.
Well, I don't think so. We are in a new era, and we are building new ways of working all together. That means that we have to put all together our strong willingness in order to better to improve the way we are working all together. So we have to take new habits, I want to say. We are in a transitional phase, and we are building new elements which are going to make us stronger. So I'm not anxious about that. The fact is that we have to prevent and to anticipate better, but altogether it will be feasible.
Wonderful. My last question will be for you, Natalie. We have a question of how can we realistically become more strategically autonomous? This is obviously a buzzword that we hear a lot right now in Brussels when it comes to producing medicines and top-tier medical equipment.
Well, I think the objective is not to be strategically autonomous. It's to make sure that we continue to have that provision of everything that we need to deal with day-to-day healthcare as well as with pandemics. And you've probably heard it a lot during this pandemic. The supply chains are integrated and global, and they will remain integrated and global for many reasons. Also because it's different things are sourced from different parts of the world. The important thing for us as an industry is to make sure that those supply chains are protected and supported and so that trade is allowed, that there are no obstacles, no obstacles, export restrictions, export bans at any moment. We saw at the beginning of the pandemic what closing down borders meant to being able to move around medicines or protective personal equipment. It's something that we can never afford, and now in the development of vaccines could be the biggest barrier to increasing production. So I think the objective globally, healthcare is a global issue. Pandemics like this one are global. There are no borders, and the same goes for producing healthcare products. If you think the vaccine, the Pfizer vaccine, since we talked about it a lot, has 280 components coming from 86 factories in 19 countries. There is no desire to make that local, but there is a very important responsibility that we all share to make sure that those supply chains are protected and that goods can flow quickly and easily between countries.
Absolutely. Thank you for that, Natalie. I see we are totally out of time. I do want to close the poll, though, and see what the audience was thinking about HERA's ability to prepare the EU for the next pandemic. I see 71% said no, which is less optimistic note to end on. However, this is really just the start of this conversation. I'm more than happy we'll be having many more conversations, I'm sure. I first off really want to thank all the speakers for spending their Thursday morning talking about this. And all of the people in the audience for watching. I really appreciate it. Please send your feedback as well to live@politico.eu. Hopefully we'll fare better than the UK did at the Eurovision last weekend. And please feel free to tweet at me, and I will definitely be speaking again soon. Thank you all for tuning in.